Welcome to the Holistic Health Bites podcast. I'm your host, Andrea Nicholson, crime scene investigator turned functional health investigator. This podcast is here to share bite-sized episodes and unique interviews on a wide variety of health topics to empower, enlighten, and educate you to live your best, most vibrant life. Disclaimer: all information you hear on this podcast is for information only and constitutes individual opinions of the person speaking. This should not be taken as medical advice. Being a listener of this show does not initiate a practitioner-client relationship between you and the hosts or panelists on this show. Please discuss these topics with your medical professionals before making any changes to your health. Okay, let's dive in. Welcome back to the Holistic Health Bites podcast. Today, we're going to have a fun conversation about several different things, actually. I'm joined with my special guest here, Wendy, who is going to share a little bit about her background and her knowledge of genetics and how that plays into dealing with various chronic conditions and things like Lyme disease and just all the things. So we're going to talk about lots of fun things today. So welcome, Wendy. Thank you so much for joining.
Thank you. I'm very excited to be here. A little bit about me. By trade, I'm a professional photographer. Unfortunately, in 2018, I became bedridden from Lyme disease, and I really struggled with my personal health. And with that, I started to research. My body didn't work really well, but my brain still did. So I dug into the book Dirty Genes by Dr. Ben Lynch, and it changed my life. I started to get into genetic testing, but I kind of hit a dead end and was kind of left with pharmaceuticals and really not a lot of hope. So from there, I started just digging into what I could find out about Lyme disease, about genetics, about, different things with my nutrition. And that led me to my current career as a certified holistic health coach with certifications in functional nutrition as well as genetics. So I feel very well-rounded because I had such a battle with Lyme disease. I had a hard time eating food. I had a hard time with my environment. Everywhere I went, I seemed to be just allergic to life. So that took me to my new career where I'm able to I currently work with a lot of women and a lot of women who have battled Lyme disease. But I love to see that there is hope. There is a root cause of these illnesses that are often misdiagnosed or undiagnosed. So I'm able to analyze genetics and help people figure out what nutrition is the best for them, what environment may not be the best for them. I live in Beaver County. I live near a cracker plant and a power plant, and my body has made it very clear to me that it's not where I should live. So I'm actually in the process of moving, hopefully somewhere warm and sunny, because the winters are always hard. But I'm very excited to, be able to work in a field that's just upcoming, and the research and adding in AI, and just to see all of this different data that we've accumulated over the years, that we can really see a difference in everybody's health and metabolic health, in their hormonal health for women. I think there's a huge need in America for those of us really sharing our knowledge to help women and show that we can be healthy and we can thrive and be successful.
Yeah. Wow. There's so many things there. We're going to dive into all the things. So I don't know. Let's start with maybe some Lyme disease stuff. So can you just tell a little bit about, what Lyme disease is? How do people get it? How might they know they have it? Who's at risk? All the kind of things about Lyme disease.
Sure. I live in Pennsylvania, which has been the highest state of Lyme disease for the past, I think, 7 years now. Unfortunately, getting a diagnosis is often difficult, especially if you have other co-infections. So you may have your body overloaded with Epstein-Barr, or not just the Lyme bacteria, but Babesia. For me, I had Mycoplasma pneumonia, which was essentially walking pneumonia. So I was literally walked around for the testing went back over 10 years. So often it's associated with ticks, high tick areas. That could be in an area where there's a lot of wildlife. So the northeastern United States has the highest rates. Lyme is actually named after Lyme, Connecticut, where they first discovered. Since then, I study under the Tick-Borne Illness Working Group. I'm actually volunteering to be a member of the ILADS, the International Lyme Disease Association. So there's a lot of different things now showing that it's not just ticks that could carry Lyme disease, but fleas, mosquitoes, other vector-borne illnesses. So there's a lot of, unfortunately, it depends on where you go, on what you learn about Lyme disease. I'm in a few support groups of probably 200,000 people. And unfortunately, we're all given a different diagnosis. We're all given a different treatment path. But for me, for genetics, what I found is that I can't really process pharmaceuticals very well through my liver. And since I was diagnosed with Lyme disease, I've had 3 current infections. They're just in my neighborhood. They love me. I guess I put off this beautiful scent that they find me. But the last infection I was able to clear within 5 months because I knew that my body struggled with clearing the bacteria. So I could go down the path of herbs and go down alternative treatments like sauna to help my body detox, or I had to go through some hair mineral testing to see that my body was just so far off in my vitamins and minerals. So healing is such a complex thing in Lyme disease because you could have co-infections. My son, unfortunately, was diagnosed with Lyme disease, but he couldn't pass a positive test. But I knew from the signs with myself that there was something wrong. I mean, he was 8 years old and he couldn't walk down the hallway without kind of dragging his leg. So we were able to work with a functional nutrition doctor who did some advanced testing, and then he ended up having 7 to 10 bans through the CDC.
Wow.
But knowing our genetics, I also had his ran, so I knew we had to go more of an herbal treatment route for him, as well as just some additional detox. Epsom salts baths became his nightly routine. So it's complex. It really is a complex disease. It's often misdiagnosed or undiagnosed. I'm an advocate for Lyme patients. I talk to 3 or 4 patients a week just to give them hope that there are doctors out there that will help them. There are treatments out there that may work for some and may not work for other people. Unfortunately, by the time I was diagnosed with my first infection, statistically, there was 500,000 people diagnosed with Lyme disease. So, I hope to share the message that it's something that needs to be more in the forefront of our medical community, and just the support. A lot of statistics in Lyme disease, the number 1 killer of Lyme disease is suicide. It's a very sad statistic, but it's people feel often alone. The bacteria can cross that blood-brain barrier and get into their brain and cause a lot of neurological issues. And I had a time where I had tremors all day long, and my neurologist is still stumped to this day. But we were able to, track things and work with my genetics and work with my nutrition, and now I'm thriving, and I'm getting to help others and getting to talk to others, professionals like you, to help share the message that it's something that needs to be addressed and talked about, and that we can heal. A lot of people in the Lyme group, they don't feel that there's any hope for them, and that's where I want my message to be, that there is hope.
Yeah, that's good to know, because I've definitely heard lots of people say that once you have it, you always have it, and you can, reduce symptoms, but that's about as good as it gets. And so it's good to know that that's not true. And with the right treatment for you, it is possible to actually clear it. And that's really important. You mentioned a couple times a lot of co-infections, and it seems like most of the people I've come across who've had Lyme issues have all had co-infection or not necessarily infections, but comorbidities or co problems. They've had other diagnoses, whether it be autoimmune or like the viruses you talked about, or some of these other bacteria. So it certainly could be co-infections, but it seems like a lot of people also have other things going on. It's not just about Lyme. Is that kind of what you've seen as well?
Yes, absolutely. And my functional doctor kind of said that it's like the straw that breaks the camel's back is kind of the way to describe it, that your body just gets overloaded and then everything else just takes over. So if you're battling this unknown bacteria, then the viruses you're exposed to kind of take over, or the food sensitivities. With myself and my son, we didn't realize we had these underlying sensitivities, but when our body became weak, these genetic predispositions and these sensitivities kind of came to the top of the surface. So, everybody just feels just bombarded from every direction. And it's like peeling an onion when we, for treating it, because you have to look at, okay, well, what's on top. A lot of times it's heavy metals, that's parasites, it's things that are just keeping your body out of sync. And a lot of that goes into the metabolic health, the genetics, the lifestyle, the environment. Once one of those things kind of falls, it's this domino effect.
Yeah. Yeah. There's so many things going on with it. And so that makes sense. So, what kind of testing might someone undergo if they're having these kind of mysterious symptoms and nobody can figure it out? And they're wondering if maybe it's Lyme or one of these other, similar infections? What kind of testing might they look for or ask about?
Yeah, I definitely, working with, I call it a LLMD, a Lyme literate medical doctor. So there are a lot of medical doctors that are not familiar with Lyme disease. It is such a complex. So finding a doctor that is familiar with it. For me, I went to a Lyme literate doctor, but their approach was pharmaceuticals, and I did for 7 months. I did pharmaceuticals and antivirals, and I got very sick from that. So I had to find a really good functional medicine doctor who looks at root cause. And they have different testing options. There's one of the top companies they recommend is epigenetics, and they do very specific testing for Lyme, for co-infections. So finding a medical team, and I will say a medical team because I had heart issues. I had issues with my neurological, as sometimes I still struggle with. I will be very honest. Sometimes the words don't come out right. So having a team that understands and that works with you, there are advanced testing out there. There's the genetic testing to see if your body recognizes the bacteria, or if it's like, hey, come in and have a party and, wreak some havoc. And for me, I have these inflammatory markers that my body gets overloaded with inflammation. So, having a functional doctor that's able to look at more root cause, they have access to this testing, and the amount of amazing testing that's out there now is really wonderful for the Lyme community.
Yeah, that's good to know. Good to know that there's lots of options and there are, Lyme literate doctors out there that you can look for. That's a good term to know so that you know exactly what you're looking for. So that's really helpful. I'd like to turn a little bit. You mentioned the genetic testing and some of that, just the genetic background and things that can change. How does that, it seems like a lot of people believe genetics just are what they are. So how does that help you? Because I mean, you and I both know that that's not true. There's a lot we can actually do about our genes. They're not just black and white, yes or no kind of things. They are what they are, but there's a lot of things you can do to dictate if they're turned on, if they're turned off, if they're, where that dial is set at. So tell me a little bit more about how you use genetics and what kind of information it can really tell you.
Sure. I had really put off genetics for fear of the same thing, right? I didn't want to, I did go to a genetic specialist and they said, sorry, here's some medication, here's this, and I was really discouraged. But then I read Dirty Genes by Dr. Ben Lynch, and the book, it changed my life. I could see that I learned about epigenetics. So, there's so many studies out there of identical twins that have the same genetics, but they have different food patterns, different environments. So then they have risk of different disease. So I started to see that, okay, well, let's go down this path. I've went down every other path. So from there, I was able to, I had a few testing. My functional doctor ran a test to see if my body it's a HLA-DR, so how my body handles inflammation. So from there, we could see that I was susceptible to Lyme, susceptible to some environmental toxins. And then we could see that, okay, well, if I have this gene issue, what affects it? So for me, it was mold, airborne mold. My body cannot process it out. It causes inflammation. So once we were able to see that, And we discovered that we had a home that had some mold in it, and we had remediation, and I started to detox the mold. Then I started to actually show positive on a Lyme test, where for 10 years I fought with my doctors. I said, I know it's Lyme. I've studied it. Like, I'm telling you, I have nothing else to do. I can't work, but I can study. So I was able to see that, okay, well, if I pulled some of these factors out, I would be able to change how my genes were expressing. So then my genes were like, okay, I'm not so angry, so to speak. I'm not so upset. I'm not going to, they say you can turn some genes on and you can turn them off. So I really looked into, okay, well, what else can I do with this data? So I started to study more under Dr. Ben Lynch. He has Strat gene where we can look at pathways. So I was able to look at my methylation pathways. And a lot of people are familiar with MTHFR, but methylation pathways are, your folate pathways and your SAMe pathways, and your whole system, this interconnected, beautiful system that runs our body. So then I was able to, just keep pulling things out that were overloading my system. I could pull out, the makeup that I didn't realize I was sensitive to the ingredients in it. I could not use a dish soap that was causing my body to have these endocrine disruptors. So after studying that, I was like, okay, well, what else is out there? And I discovered a company called Gene Food, where I could take my raw data and they would tell me how I should eat. And I was so blown away that, I was put on a paleo diet, which worked because I was eliminating sugars and I was eliminating a lot of unhealthy foods, but I was overloading myself with oxalates. Well, through genetic testing, I could see that for my body, it's harder on my kidneys. It's harder on, my calcium level. So I was able to really kind of fine tune how I was eating, as well as what environmental toxins I was exposed to, or what things in my daily life that, might be normal for you. But for me, my body's like, hold up, Wendy, this is too much. So then from there, I thought, okay, maybe this is something I could do as a career, because I was always, I got it, right? I was having such brain fog that I would put, a box of something in the refrigerator, but I could remember about these genetic pathways. And I was like, okay. So I came across a company called Self Decode, and they run genetic testing, but they also analyze genetics. So I'm currently a practitioner under them. I've worked with 16 clients where I was able to help them find the right nutrition path for them. I was able to help them find the right environment, or things that they could remove from their environment so they could start to heal. They could start to see, oh, okay, well, my joints, maybe this isn't something, maybe it's something that I'm putting into my body, and that my body is saying, hey, this is something's going on here. So I'm actually just finishing up a symptom journal, because that was something that my functional doctor was like, hey, let's track your food, let's track your symptoms and see. And then we can look at that from a genetic standpoint and be like, okay, well, I was eating spinach every day, which is very high in oxalates. And I kept having these right side pains that my doctors are like, we're not really sure what's going on. Well, it was my kidneys were overloaded with oxalates. But, here I was thinking I was doing everything right, but I was doing everything good, but not necessarily what my body needed. So your body's always talking to you and telling, different things. And you're right, you said it perfectly. Genetics, they're not black and white. Like, there's a day that I could go eat something and I'm not going to have an issue. But there's a day where if my body's overloaded with everything else, my body's very clear at telling me, hey, this, I know you like chocolate, but you have to, kind of be mindful of what you're putting in. And so, I think that there's a huge future in genetics, and it is not to scare people to say, oh, well, you're at risk for this. It's to say, okay, well, if you are at risk for, issues with Lyme disease or metabolic health, or For me, one of my top biohacker reports, I'm at high risk for MS, and having my mother-in-law, unfortunately, she passed away from her complications from MS, but I didn't look at that as a scary thing. I looked at that as, okay, well, there's links to Epstein-Barr, there's links to vitamin deficiencies, there's links to inflammatory issues. So then I can really focus on, how I'm living my life to have optimal health, so I can avoid those things, or at least, work with my medical team to say, hey, look, I'm at risk for this. I need you to help me create a path to wellness, a path to, and especially for my son. So not only genetics are going to help me, but for my son. I mean, I had my first surgery when I was 7 years old, and my fifth and sixth surgery by the time I was in my 20s. And it was all like, well, we don't know what's wrong. We don't know what's wrong. And, all these years later, I wish I still had my gallbladder, because I really needed to support my liver. But, now working with Dr. Ben Lynch in Seeking Health, we can take vitamins or supplements that help our genetics. So, I can take a ox bile. I take it every meal to help my liver because I don't have that gallbladder support. So not only, with the genetics, we can supplement how we need to, whether it's for food or, with medical grade supplements. So it's such a I'm very blessed to be in here. I'm blessed that 5 years ago I didn't remember my son's name. I couldn't get out of bed, and now I'm getting to help other people and their families, and to see that the science is it's this beautiful thing out there that we can embrace it. And it shouldn't be a scary thing. It should just be just one more tool, so to speak, that we can use to live these lives that we all want. We all want to be healthy, and we all want to be happy. And I'm very excited, and it really has been. I had to literally go in to find out how my every cell in my body worked to heal, but now I'm thriving, and I'm getting to share this with you and your listeners, and it's just a blessing.
Yeah. And it's such a testament to how personalized this whole journey really needs to be. That, this is a classic example of why there's no one perfect diet. There's no one perfect protocol or one, it's going to be different for everyone. Part of that's genetics, part of that's environment, part of that's preferences, tastes, all, those kinds of things. There's so many things that change. We really have to be open to doing it in a unique way and looking at the deeper levels so that exactly what your unique body needs. And I think, you gave a lot of great examples of things that were good or, were seemingly the right choices that were not the right things for your body, or were not the right things for your body in that moment, at least. Maybe that's not necessarily something that will always be true, but, not everyone is as sensitive to oxalates. Some people can process them just fine. Other people really can't. And so I know sometimes people get criticized for being, picky eaters or, high maintenance. And no, it's literally your body can't handle it. And it's not a choice. It's not something you're opting in to be, you're not trying to be defiant or difficult. We're all different. And so I think that's a great story to share, that if you're not getting the results you need, it's probably because you haven't found that thing that's still holding you back, whether it's a missing thing or too much of a thing. Like, there's the whole spectrum there too. So I think that's great. And you gave a lot of great examples of, how to find out what those things are, through the genetic testing and the epigenetics, and, just taking a really good hard look at what you're doing. So I think that was a great story. If people are interested in learning more about your work, how they can work with you, where they can, get this kind of testing, or, just start their own journey, what would you recommend for them to do?
First thing I would do is say that if you've had your genetic testing done already, get your raw data. I know there's some changes in 23andMe where they're not releasing it. And I don't know if that means they're not releasing it to people that have already had it, or if that means they're not releasing it to people going forward. Because if you have that raw data, you can go yourself to StratGene and get figure out what your methylation path is. You can do self-decode on your own, or you could work with a practitioner like myself. gene code. So there are these different companies already out there. So that would be the first thing, is that if you've had Ancestry or 23andMe, or if you had somebody, make sure you get your raw data. Have that in a good, secure place, because there's going to be more companies, coming out in the future that can analyze that data. And there are a lot of different practitioners out there. I see a lot on Instagram. So, using your tools that you already have, when you're scrolling through social media, just, look for us. We're all out there. There's not a lot of us right now, but I do believe there's a huge future in that. So, a lot of people go to 23andMe or Ancestry to, find out where they came from. But, if we can kind of take a look at, where you came from is such a factor. I mean, my ancestry is Northern European. So it makes sense that Mediterranean diet works more for me, because that's just how I'm built. So, if you have that data, if not, there are testing, there's saliva testing, for me as a practitioner under self-decode, if somebody wants to work with me, I can give them a saliva test, and in 5 to 8 weeks, I can share their book of life with them, so to speak. I can give them a diet plan, or even a nutrition plan, or not nutrition plan, a exercise plan. So, because again, the same thing, just what works for you may not work for me. So I'm not a runner. I get exhausted too easy. But, those are some of the things that, with all of this data that we've been able to accumulate throughout the years, and the AI learning, like, we can really fine tune somebody in their health. And, my website is clicksforacause.com. My photography work, I worked with nonprofits, and I helped spread message, because my sister-in-law passed away from cystic fibrosis. So Clicks for a Cause was more about clicking with photography. And now Clicks for a Cause is more about clicking to find, okay, let's look at your genetics. Let's look at your health. And, so I would definitely, tell people, if they're interested, don't be scared of it. The company I work for, Self-Decode, it's very much about safety and security. They're not sharing the data. It's not data mining. It's very much for your health. Same with StratGene. And I can even analyze, if you have your 23andMe, you could send it to me, and in 10 minutes, I could help analyze your genetic pathways to see, okay, well, if you do have some methylation issues, maybe it's not just the MTHFR, but the MTRR. So for me, I was put on methylated B vitamins, but I would get these excruciating headaches, because it turned out other part of my methylation pathway, I couldn't break it down. So therefore, I needed to work with Dr. Ben Lynch and Seeking Health, and finding a methyl-free vitamin that my levels are finally, where they need to be for my B vitamins. So, I would just encourage anybody to just keep going in your search. If you're really struggling, there are so many options out there.
Yeah, I think that's a great way to look at it. And that, a lot of us do have that data, and, maybe we did it just for kicks, just for interest, to find relatives, or to, know what your genetic propensities are for, can you roll your tongue, or whatever silly things are on some of those reports. But there's some really good data behind it that they may not have told you about, because they obviously aren't giving you all the things. And then I think, like you said, there's such an opportunity here. So even if you do find out that you have some higher risk of something, look at it as an opportunity to do something about it. If you don't know about it, you can't do anything about it. But if you know, you can do something about it. You can reduce your risk. You can, take that opportunity to improve something about your health, or change something. You actually do have ownership over this stuff. So I think that's a great way to look at it, and, take the data you have and get all of the information you can out of it. So it's good to know that there's lots of options out there for people who do have that data that they can run with. And if they don't, then of course there's resources to get the testing so that they can get that data. I think that's awesome. So we will definitely link up your website and information in the show notes. Is there any last words you'd like to leave everybody with?
I would just like to say that there's hope. And I think that, there's been a lot of change in the culture, and in the science, and the medical community. But I would just tell anyone that's struggling out there with their health that there is hope. There are people with these beautiful podcasts like yours that have this wealth of knowledge. And, and I would say that if there's a day where, you feel like you lost hope, that's when you dig in. That's when you take that fear, or the ache that you have, and you just, you said you take control. Like, I sat and I cried when I was finally diagnosed with Lyme disease, because I just felt like everybody was just, they left me to die. And, I hold on to that every day, knowing that if there's somebody that I can inspire out there to, to just take ownership and take control. And if your doctor's not listening, find another one. If your family doesn't believe you, they don't have to. Nobody has to, because you live it every day. And if you're, living something that's difficult, reach out to, share it. A lot of times we kind of go in within, and we kind of hide when, we're not feeling well or we're struggling with something. But I would just share, especially with women, the statistics in women's health in America are just, they're heartbreaking. And, I am, that is my passion. I will work with men, I will work with kids, but women, I just feel like a lot of times we're thrown that, well, it's hormones or it's something else. But, you live in your body every day, and trust it. Trust what your body's telling you, and journal. And that way, you can start to see if there's patterns, if there's something in your health, because, you deserve it. You deserve it. You deserve health, and you deserve, starting this new year, if you're doing resolutions and you need help and support, there's so many of us out there that are, want to support you, and, always keep that hope.
Yeah, for sure. I think that's a great message to end on, because there is hope for sure. So thank you so much for sharing all of your story and your wisdom with everybody. We really appreciate all of the insights, and I definitely learned a lot here today as well. So thank you again for coming and sharing. And thank you to everybody else who's listening. Be well and vibrant, and we'll catch you on future episodes. Thanks for being a faithful listener to the podcast. I'd love it if you left me a 5-star review on this podcast so that others can more easily find this valuable information. Did you know I also work one-on-one with clients? I approach solving health challenges like I approached solving crimes, by conducting a thorough investigation into your case. Sadly, hundreds of millions of people in the US have insulin resistance, prediabetes, and diabetes, and the vast majority have no idea. I'm here to fix that. If you struggle with low energy, stubborn weight, hypertension, sleep disturbances, or any other undesired symptoms, let's talk. All you have to do is schedule a free call. The link will be in the show notes. And no, you do not need to live near me.